Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. If you follow my channel, you know I'm a cosmetic facial surgeon in Richmond, Virginia, and I do surgery from here to here, and I don't do boobs, bellies, and butts. Okay, what about that title? Don't have chin filler without watching this video, okay? So what do I mean by that? Well, it's kind of important if you're considering this, so we're going to talk about it. Now, I'm a board-certified cosmetic facial surgeon and a board-certified oral and maxillofacial surgeon. So I grew up in the face and the jaw, and I've been doing chin surgery for 30 plus years, and I've done probably several thousand procedures. And so I know the chin, I know the face. Now, chin surgery or chin filler has become very popular, and there are many specialties now that are doing this that really never had any intense education about the chin. And I don't say that in a negative way, because there's so many things that we all do that are new techniques, and but the situation is that I see some really nice chin filler, and I do some myself, and then I see some cases that should not have had chin filler. Okay, so let's start with the answer, okay? A nice looking chin on a male or female is proportional, and it can really make a big difference on the face. And we tend to judge people with very weak chins or kind of judged timid. People with strong chins are judged more aggressive. And I could do a whole lecture just about the role that the chin plays in beauty, okay? So some people have recessive chins. I have a little bit of a recessive chin myself. And if a person has a chin that would benefit from just a little anterior or front projection, you can put a little bit of filler in there. Many people have chins that are short, and they're like this, and they have a deep mentolabial fold. And I'll probably do a little lecture at the end of this video so I can actually show you pictures of this, okay? And so if you can put a couple syringes in somebody's chin and make them look natural, that's great, okay? But there's a couple things I say, and here's the caveats for this video. Number one, I see some people that had 6 or 7 syringes of filler, all right? And, you know, that's almost $5,000 of filler, and they have these big floppy chins. And I'm going to show you a video of a big floppy chin on somebody that came in the other day that just had too much filler. And just because you're making a chin prominent doesn't mean it's going to be natural, right? Our chin is bone, it's hard. And so I think it's very important that anybody that's going to have chin filler injected, and any practitioner that's going to inject it, understands the chin enough to be able to educate their patients. For instance, there are many patients that have no business having chin filler, okay? It would take too much filler, it would be too expensive, and it might last a year or two, okay? And you know as well as I do, filler usually doesn't last as long as doctors say it's going to last. So these patients would benefit from a chin implant or an osteotomy, which is called a genioplasty, where we cut the bone, we move it forward and frequently down, okay? And those are procedures that take under an hour, and they last a lifetime, okay? And, you know, depending where you live in the country, you could do those procedures for anywhere in the $4,500, $6,000 range, somewhere like that, and it's going to last you the rest of your life. So in terms of putting that much filler and having a floppy chin, that's a mistake. You really want to do your research before you do that. Now, you know, I do a lot of chin implants, I do a lot of cheek implants, I do a lot of facelifts, I pay a lot of attention to this area, and I've done chin filler for years, before it was cool, right? It's like I was country before it was cool. And so it's something that's fine on the right patient. And if you can use 1 or 2 or maybe even 3 syringes of filler and build that area up, that's great. Now, it's also very trendy to do full jawline filler enhancement. And again, that's fine, but you can end up spending, you know, $10,000 sometimes and have a result that may look good, but it's flabby, and it may last a year or two. Okay? So I'm certainly not saying, oh, listen to me, I'm the only person that knows about this and nobody else does. But you just want to make sure you're doing the right thing that's going to benefit you financially, safety wise, and something that longevity is very important. Okay? And that's not to say that it's impossible to have a problem with a chin implant or an osteotomy, but they're very rare. So I hope this makes sense. And again, I don't want to present this in an alarmist way, but anything you do, you should do your homework and see what your options are and what the complications are, how much something's going to cost, and how long it's going to last. So I'm going to show you a little PowerPoint lecture to enhance this, and I hope it helps. So don't do chin filler without doing your homework. I'm Dr. Joe Niamtu, lovethatface.com. Hi, I'm Dr. Joe Niamtu, lovethatface.com, and we're going to do a little talk here, a little lecture, a little PowerPoint presentation on chin filler and when it's a good thing to do and when it's a very poor thing to do. So follow me. I'm very involved with academics. I teach courses at my office. I have a for-purchase video series for surgeons, and my new textbook will be out soon. And I've written a number of major textbooks. So academics is very important to me. So a weak chin is often associated with a weak personality, and people with strong chins are thought to be more assertive, more aggressive, more handsome, and a weak chin is the opposite. So chins are very important in our aesthetics and our personality. And an aesthetic chin is really a hallmark of beauty in males and females. And some people are known by their excess chin or lack thereof. So let's talk about ways that you treat chin hypoplasia, or basically a recessive chin. And we're going to talk about filler and when not to use it, but there are a lot of ways to do this. So first of all, if your bite or your jaw or your teeth don't line up, then oral and maxillofacial surgeons may elect to do orthognathic surgery where you're moving the facial skeleton, and that will enhance the chin. Obviously, most people aren't doing that in the outpatient cosmetic office. One of the caveats of either if you're a surgeon or and you're injecting somebody, or if you're a patient considering injection, is if you have a deep mentolabial fold. That's that fold between the lip and the chin. And usually or frequently, these patients aren't good chin filler candidates. They would benefit from some type of surgical treatment. Not everyone, but I'll explain that further. So when you have this deep mentolabial fold and you have a chin that is recessive in the horizontal plane and short in the vertical plane, these are generally not good filler patients. And it's not that you can't do it, but you might take 5 or 6 syringes of fillers. It would be very expensive, and then you would have this big, floppy, fatty chin. And so that is not a good candidate for filler. And again, you know, just because somebody has recessive chin doesn't mean they're going to do well with filler. Here's a patient that has a deep mentolabial fold and a short vertical and was injected with filler, and you can see just this bulbous, floppy chin, and that's not what you want. So basically, if the if you have a recessive chin and the lower lip is posterior or behind the upper lip when you drop a vertical, and you have this chin that is short horizontally and short vertically, these are not good filler patients. It just won't look good. It'll be very expensive, and it won't last long. So when you do see this type of situation, don't even consider filler. All right, you're not going to be happy with it. And again, it would take so much filler, and it just wouldn't look or feel natural. So this patient needs horizontal improvement and vertical improvement. So, and again, this type of patient will come in and they'll show you exactly what they need. They need a longer chin. And in this case, we perform a genioplasty. where we're actually cutting the chin bone, moving it forward, and we're able to increase it horizontally and vertically. So that's the proper treatment for somebody that has that really short chin, and especially with a vertical excess where they need a longer chin. So here's a patient before and after genioplasty that I performed. Here's another patient where I did liposuction, buccal fat reduction, and a genioplasty. So what did we do here? Well, we made her chin longer, and we also made it come forward. So you can see we've increased it horizontally and vertically. This would have been a terrible patient for filler. So if somebody has a relatively long enough chin, but just needs that horizontal uh, increase, in other words, a more protrusive chin, then these are would be a better filler candidate or chin implant candidate. So I do a lot of chin implants in my office, and let's just talk about chin implants and filler. So, if you can do 1 or 2 syringes of filler and it lasts for a year or so, that's pretty good, and it'd be a good investment if it looks natural. And it's also a good test drive in case you want a more permanent procedure. So chin implant surgery can last a lifetime. It's a 3D augmentation. There's a lot of different styles to choose from. And this is something that I do a lot of in my practice. You can do this from inside the mouth with an incision or under the chin. And then when we use these, I always use 2 screws to hold the chin in place so they don't migrate. And that's very important. So these are before and after chin implant patients, and you can see that we have mostly horizontal here. Again, before and after this patient, I did cheek implants and chin implant. This is a facelift and a chin implant. So you can see what that chin does. And it's, again, unlike filler, it's going to be permanent. Same thing here, chin implant and facelift. Here is a chin implant, a rather large implant, and it just really makes such a difference. So it takes about 40 minutes to do this procedure. I do it under general anesthesia, and again, fixate them with screws, and they can be a lifetime and one-time treatment, unlike fillers that you have to do repeatedly. And I am going to talk about fillers here in a couple minutes. Again, this is a chin implant. So it's one of my favorite operations because it's a short surgery. It's reversible if the patient doesn't like it, or if they want a bigger or smaller one. It's very easy to service. And they're made out of silicone, which is a very biocompatible material. And again, before, after chin implant. Now, you probably could have done filler on this patient, but again, it's going to take a lot of filler, it's going to be expensive, and it's going to be temporary. But sometimes that's all somebody wants or needs. Here's another chin implant. Okay, let's talk about chin filler, okay? So our goals are to balance the face, and you want to have an age appropriate and gender appropriate augmentation. You want to pay attention to the menolabial fold, and you do not want an overcorrected floppy chin. That just looks and feels terrible, and there's a lot of expensive filler in there. So sometimes with chin filler, it takes several sessions to get it where you want it. And it's a pretty simple procedure. We usually numb the patient and then just put the filler in the center and on the sides and taper it out. And for the correct patient, it's very simple and very easy, and it's a great correction. And what's interesting is, again, uh, I'm board certified in cosmetic facial surgery, but also in oral and maxillofacial surgery. So, um, as I said earlier, I've been doing chin treatments for about 3 decades, and there are a lot of people out there who are just discovering the chin, and that's not to say that they don't know what they're doing, but it's kind of been an interesting phenomenon how all of a sudden chin treatment has become popular. So again, it's a pretty simple procedure. Sometimes I'll make an outline and just fill it up to where I'm happy and the patient's happy. I mentioned the mental labial fold. If you have a deep fold, it's important that you put filler in there, otherwise your chin is going to look unnatural. And you can actually push the lip up and push the chin down, but that takes a lot of filler in that area, at least 2 syringes, so that can get expensive as well. And this is chin filler case that I did. Another case of chin augmentation with filler. In this patient, sometimes the patient's not sure if they want an implant, so I'll do filler, and that's going to kind of show them what they would look like with an implant, and they'll come back for an implant so they don't have to repeat filler injections. Before and after filler to chin. Another patient I treated before and after filler to chin in the mentolabial fold. So this is a very, very speeded up video, and I'm not going to play the whole thing, but just kind of show you how we do filler injection to the chin. And I use personally hyaluronic acid filler. I think they're very versatile, and they're also reversible. If for any reason the patient doesn't like it, you can dissolve it. And some patients, they don't really need projection, but they need a longer chin, as I spoke of earlier. So if it's kind of a minor lengthening, that's pretty easy to do with fillers as well. So a couple things to remember. A bigger chin is not necessarily a better chin. It has to look good for your age and for your gender. Injecting in the deep, middle, and superficial planes gives good support without causing floppiness. But if you're really trying to augment a chin that needs surgery or an implant, and you're putting 5, 6 syringes of filler at, $700 a pop, you could almost pay for an implant, and that's going to last you uh, a long, long time, if not forever. So again, on that vein, although filler is a great option for chin augmentation, it may not be the best, longest lasting, or most economical alternative. So anybody that injects chins, it's important that they understand the other options that I talked about, the jaw surgery, the genioplasty, and the chin implant. And I see a lot of filler patients that do it once or twice, and they just don't want to go through re-injection and keep paying the money, so they will settle on a surgical solution like a chin implant. And so this is basically my little talk here. I hope this kind of explains the various diagnostic situations and pitfalls for chin augmentation, as well as the proper surgical treatments, and finally filler treatments. So what's the bottom line? Chin filler is a neat thing. I've been doing it for a long time. It's kind of trendy right now. A lot of people have just discovered it. I think if you can augment somebody's chin with 1 or 2 or 3 syringes of filler, um, it may be worth it. And what I see is a trend that patients don't like to keep getting injected and keep spending that money, and they may do filler and then settle for a surgical solution like a simple chin implant. So I'm Dr. Joe Niamtu. Always be a teacher, always be a student, and thank you for watching.